Good evening, all of you. So welcome to this session on Medet Clinics. So today we'll be discussing some more topics regarding dermatology. So first of all, kindly confirm if I'm audible and visible. So hi Avaya, very good evening. How are you doing? Welcome to this one more session. So please confirm in the chat box. If everything is fine, we can get it started. So in today's session regarding Medet clinics, so in this Medet clinics, the primary intention is that when you go to your clinical postings, things should be much more easier for you because you are having that good orientation, correct? So in today's session, thank you for the confirmation. So in today's session, we are going to discuss about the approach to pigmentary disorders in dermatology. Now, all of you must be knowing what is a pigmentary disease, right? So what do I mean by a pigmentary disorder? Any idea? Can anybody let me know in the chat box? What do you mean by a pigmentary disorder? So pigment means color, isn't it? So whenever there is a change in color to the skin, so we call it as a pigmentary disorder because it revolves around some change in color, correct? So what is a primary cell that is responsible for any of the pigmentary diseases? So a lot of diseases would be coming to your mind when I tell you about a pigmentary disease. So so Mohammed Jafar is saying that there is a melanin imbalance. It's a nice answer. I would completely agree. But to be very specific, I'm asking you, what is the name of the cell that is most likely to be implicated in a disease where there is a pigmentary disorder? Excellent. The correct answer is a melanocyte. That's it. Okay. So melanocyte. So we all know that this is going to be the melanocyte. Chalo, I'll just zoom it for you. So this is how a melanocyte looks like. Okay. How does a melanocyte looks like? It has finger-like projections. So these are dendritic cells. So melanocytes, they are dendritic cells. And where is a melanocyte derived from? Is it derived from the ectoderm? Is it derived from the endoderm, mesoderm, or a neural crest? Hi, Kalai, good evening. Very good evening. So where is a melanocyte derived from? So please remember that this is derived from neural crest. Neural crest. So what happens in a journey of the development of the cells of the skin is that this melanocyte, which is going to be developed from the neural crest, so this melanocyte is going to be transported to the stratum basale. So from the neural crest, there is a transportation. And after this transportation, where does this melanocyte end up in? In which layer of the skin does it end up? Hi Shiv, I'm doing good. Thank you so much. So now let's come back again. Yeah. So where does this melanocyte end up in? So does it end up in the stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, or stratum basale? Yeah. So I'm getting the answer from Shiv here in the chat box. So this ends up in the stratum basale. So what happens in most of the pigmentary disorders is that either there is a arrest of this transportation and the melanocytes ends up somewhere else, like it get arrested in the dermis. So there can be some places where there is a problem in the transportation, or once it reaches the stratum basale, what can happen is that there can be multiple other defects. For example, there can be a complete destruction of melanocytes, which can happen in some autoimmune diseases and all. So there would be a absence of melanocytes, or there can be some problem with melanin pigments, or there can be some problem with melanosomes. So these are the various reasons because of which a person can develop a pigmentary disorder. Clear? So we all know that there is a disease called as albinism. So when you learned about albinism, what did you understand? there is no melanogenesis that is happening there, isn't it? So there is no melanogenesis means there is no formation of the melanin pigmentation. So based on various diseases, the etiology would differ, but every time there is one association that is very common. It has something to do with the cell that is a melanocyte. So that is a takeaway message here. Clear? So once we talk about pigmentary disorder, the main intention of today's session is that we would like to understand, or we would like to have a small classification. So we will be learning about a small classification of pigmentary disorders. Now, what is this classification that I would like to make today? It's very simple. So just see my skin. So it has a uniform skin color, right? So whenever there is something that is darker than the normal skin or something that is lighter than a normal skin, that is how the patient will come to you. That there is something in my skin. Now this is brown in color. This is blue in color, isn't it? Or something, it can be hypopigmented as well. So Virendra, this session is mostly intended for you to have a clear understanding about how to approach these diseases when it comes to your clinical practice. But during the entire thing, we'll also touch through the common diseases that we have in pigmentary disorders. Clear? And then we will also, so what we are going to do today is we will just try to understand just two broad categories. We'll try to understand in which disease conditions can a skin become hyperpigmented, in which disease condition can a skin become hypopigmented. So these are two categories that we'll learn about. And also we'll try to have a clinical evaluation of the same. We'll try to reach out a differential diagnosis based on the presentation. We will also try to understand what are the investigations that has to be done. So overall, it is like to give you a clear-cut understanding about pigmentary disorders. So shall we get it started into detail? So once we go into detail, we just now discussed about what is a melanocyte. So these are dendritic cells which is going to be implicated in various disorders, isn't it? Now, how will a patient come to you with pigmentary disorders is what we are going to discuss now. So what are the common complaints here? The patient can complain of either hyperpigmentation, or the patient can complain of hypopigmentation. So either the color of the skin should be darker, which is called as hyperpigmentation, or the color of the skin of the diseased skin should be lighter, which means hypopigmentation. और इसका भी एक और सब classification हो सकता है. So the sub classification for this one, for our easy understanding, is either this hyperpigmentation can be localized. For example, there is a brownish hyperpigmentation over the face, which means it is going to be localized to the face, or it can be generalized. Is it clear? So this can be either localized or it can be generalized. So please remember, we are just going to broadly classify these things into hyperpigmentation or hypopigmentation. So that is how we are going to deal with it. And can you tell me some of the common examples, like how a patient can present to you? मतलब क्या symptom बोल के the patient can come to your OPD? क्या ये बोल सकता है कि हाँ, there is some dark patches in my body, there is some uneven skin tone, isn't it? There are some white patches on the skin. So all those things, after getting a disease, I'm getting some dark marks, pigmentation, post-inflammatory hyperpigmentation हो सकता है. So all those are the common complaints because of which a patient can present to you. So now let's go into detail. So what do we start with? Let us start with hyperpigmentation, that too localized hyperpigmentation. ठीक है? So now let's jump into the first one, that is localized hyperpigmentation. Now all of you who is attending to this lecture right now, just imagine कि एक patient has come to your clinic and the patient is complaining कि darkening of the skin हो रहा है, मतलब hyperpigmentation of the skin हो रहा है. And what are the examples of localized hyperpigmentation? Can anybody write down in the chat box? Just try to think now. You must have learned about many diseases. You must have read so many textbooks. Now just imagine करो कि अगर localized hyperpigmentation है, जैसे localized hyperpigmentation over the face, अगर ऐसा हो गया तो what are the examples that come to your mind? So Shiv is answering melasma. Excellent answer. Wonderful thing to start with. Kalai is saying it can be a chick sign. Excellent. So this, I'm just writing down whatever you say. So chick sign, chikungunya fever that we can see over the nose of the patient. Virender, melasma ho gaya. Something similar to melasma, where again you can see some brown color lesions, especially in those people who are fair. Okay, brown color. Anyone? Shiv is answering drug-induced eruption. Excellent. Drug-induced. Very good, very good. Excellent physicians, huh? Okay. The rash of an SLE. Excellent. वो malar rash है ना? That can be a butterfly rash. So this can be due to SLE, malar rash. और कुछ हो सकता है face में? Yeah, this is the answer what I was looking for. The brown color. So that was freckles. Freckles over the face. So वो भी हो गया. Anything else? Now somebody has told me about rash of SLE. So when you talk about SLE, is there any other disease जहाँ पे एरिथीमा हो सकता है फेस में? एरिथीमेटोटेलेंजिएक्टैक्टिक टाइप, रेड कलर फेस, रेड फेस लेके कोई पेशेंट आ सकता है. Red color. Any idea? Just give it a try, because I'm getting all good answers today in the chat box. So that's amazing. So let's see. Excellent. So that can be rosacea. Very good. चलो ये सब हो गया localized hyperpigmentation, है ना? So all these are examples of localized hyperpigmentation. So now let us see some of the images also. So once you see these images, it would be much more interesting. कि अब अभी हर एक image which I have given to you today, you just have to think that you are the doctor in the OPD. So you are managing so many derma cases today. Okay. So the first patient comes down to your clinic, and you can see that the patient is a middle-aged female who is complaining of this kind of a well circumscribed brownish hyperpigmentation over the face. अब ये क्या हो सकता है? सिर्फ ये सेबोरिक केराटोसिस में ना, it is not a change in color that happens usually. हाँ, एक brown colored plaque lesions होता है इसमें, okay, which is having a stuck on kind of an appearance. यहाँ पे color change नहीं है, it's a plaque lesion that happens. So that we can rule out. But what is this? Who can answer कि what are you seeing in this image now? ये actually एक spot diagnosis है. Patient से कोई history लेने की जरूरत भी नहीं है. The moment you see this, it is a spot diagnosis. Anybody can answer? I'll just give you 5 seconds, not more than 5 seconds now. Okay, what is the answer for this image that you can see on your screen right now? The first image. So whenever you see a brown, ये macule है या patch है? Okay, whenever you find brown patches over the face. Okay, some of you are not confident. You're asking with a question mark, isn't it? Melasma. Confident raho, this is actually melasma. This is how melasma will present to you. So what you will keep in your mind is, whenever a patient presents to you or with a brown colored patch, when a patient presents with a brown colored patch over the face, answer always is going to be melasma. Okay? So that is going to be melasma. Now just see the second image now. So once you see the second image, what do you see? यहाँ पे आपको single lesion मिल रहा है या फिर multiple lesions दिख रहा है. So this is obviously multiple, correct? Or what is the color of this lesion? Let us try to describe. I'll zoom this image for you. अभी यहाँ पे what is the color of the lesion? ये red colored lesion है, brown colored lesion है या फिर blue colored lesion है. What is the color of this lesion? Yeah, this is going to be brown in color. So multiple brown colored, ये macule हो गया या फिर patch है? So what is the difference between a macule and a patch? A macule are always small, isn't it? Less than 1 centimeter in diameter, we call it as a macule. More than 1 centimeter in diameter, we call it as a patch. So multiple brown macules over the face. Now what is this called? So this one, yeah, Shiv, macule is less than 0.5. See, some textbooks say it is less than 0.5. Some textbooks say it is less than 1 centimeter. 0.5 हो या 1 centimeter, that is going to be our standards. ठीक है? Now, what is this? Now, this one is called as freckles or epaulets. Okay, so this one is called as freckles. Now all of you just concentrate on my screen now. Just concentrate on my screen for a minute. Now what am I trying to convey to you is, whenever you get a patient who is having a complaint कि मेरे face में brown colored कुछ lesions आ रहा है. So brown colored lesions, the only thing that you have to look for is whether it is a macule or is it a patch. अगर macule है, the answer should be freckles. अगर patches है, the answer should be melasma. Clear? So macules is equal to freckles and patches is equal to melasma. That is how you can reach out to a diagnosis just based on the appearance, and all these are spot diagnosis. So all these are going to be spot diagnosis. And usually, in which type of a skin type can you see these freckles? Because just try to remember this F. Okay, F you can again correlate with fair skin individuals. So what do I mean? Someone who is having F for F, okay, freckles in fair skin individuals. So whenever somebody is having a fair skin, okay, when somebody is having a fair skin, so उस time पे क्या होगा? They are more prone to get something like freckles. So it is more than in India. It is very, very common in those Europeans or who is having those kind fair western part of the world where you are having a very fair skin. Okay. So Shiv, can you just write down the entire thing rather than using short forms so that it is easy for me to understand as well? So what are you getting this freckles confused with? I'll explain you in some time. Okay. Just write down the full form of, because you have written DNP, फिर DPN. Just write down what do you mean. Okay. So now let's move. Let us see one more image, because you guys are telling about so many options that you can see over the face. Correct? So अभी यहाँ पे क्या हो रहा है? So this is another face that you can see. But this time the patient is coming to you. Will the patient tell you that I'm having some brownish color over my face? Or what is the color of the face that you see here? So यहाँ पे the lesion that you can see here. Now what is the color here? What is the answer? That's a color. So this is going to be bluish, isn't it? So whenever you can see that the patient is having a bluish discoloration over the face. So when there is a bluish discoloration over the face, what should be a differential diagnosis? So blue, okay. So black matlab, see, black is usually when you have something like a mole. Let's see that there is a mole. So यहाँ पे this is going to be अंकिता, ये grayish color हो सकता है या फिर blue color हो सकता है. So imagine कि you have got a patient like this who is having a bluish discoloration over the face, and when you examine the sclera of the patient, can you see that there is some bluish discoloration over the sclera as well. So face along with the sclera together, if you find this bluish discoloration, I'll just write down bluish discoloration over the face along with the scleral involvement in, let us say, 30% of the patients. So when you get something like this, the moment you are able to see that there is going to be a blue discoloration, the thing that should come to your mind is a nevus. Now, what is the name of this nevus? This nevus is called as nevus of Otta. So this is nevus of Otta. So why is there a blue color here? You remember that I told you that the melanocyte. So that is present, that derives from the neural crest. And from neural crest, the melanocyte has to come down towards the, so it has to come down towards the stratum basale. What happens is there is an arrest. So the arrest happens in the dermis. So when the melanocyte gets stuck in the dermis, so this is called as dermal melanocytosis, because of which there is a Tyndall effect, and because of which the skin will appear blue in color. Okay, so this is called as nevus of Ota. So this is nevus of Ota, where you get a bluish discoloration. Abhi till now what we have learned is, अगर कोई patient आ गया brown hyperpigmentation है, और अगर ये hyperpigmented patches है तो हो गया melasma, और अगर ये hyperpigmented brown colored macules है then हो गया freckles. पर forget about brown, अभी यहाँ पे brown नहीं आ रहा है. अगर the patient is coming to you with blue color, so then think about nevus of Ota. Clear? So that is it. So the differential diagnosis, very good. It can be congenital nevus, lichen planus. I completely agree with Shiv as well. So that's a good range of differential diagnosis that you have taken, that you have spoken about. Okay? So now let's see more images. So now we have discussed about many things over the face now. Now your face सब कुछ छोड़ के, now you come to a localized hyperpigmentation. Now यहाँ पे in this image, ये जो localized hyperpigmentation है, where do you find it? You find this localized hyperpigmentation over this area, मतलब हमारा shoulder area. So when you see that there is a patient who is having a localized, I'll just write down, the complaint is that the patient is having a localized bluish hyperpigmentation over the shoulder area. So when there is a localized bluish hyperpigmentation over the shoulder area, can anybody answer what is this? This again is a spot diagnosis. Like any time of the day or night, if I see a patient who is having a blue color discoloration over the shoulder, only one differential comes to my mind, most common. What is it? Spot diagnosis bhi hai. G. Kalai has already answered it in the chat box. So what is this called? So this is also called as a nevus. So what is this nevus? This nevus is called as the nevus of 𝐿𝐼𝐻. So this is called as the nevus of 𝐿𝐼𝐻. So कभी-कभी क्या होता है कि when it comes to exams and all, when you do your MCQs, when you do all this practice, so many of the times what happens is you always get confused. ये ओटा है या फिर 𝐿𝐼𝐻 है. Okay. Easy way to remember is nevus of Ota. Okay, Ota ऐसा सोचो, Ota, that is for the eyes. The involvement of the eyes is going to be nevus of Ota, and nevus of 𝐿𝐼𝐻 is going to be shoulder. Okay, so nevus of 𝐿𝐼𝐻 is going to be shoulder. So now let's see the next image. अभी यहाँ पे भी there is a localized kind of a hyperpigmentation. Now in this localized hyperpigmentation, so hi friends, how are you? Very good evening. So now let's see this. So in this localized hyperpigmentation, now all of you please concentrate on this image now. So once you concentrate on this image, what you can see is, I'll just mark one of the lesion. Can you see that this is a well circumscribed image? Okay, well circumscribed lesion. अभी ये कौन सा color है? Is it black? Is it brown? Or is it blue? Black, brown, blue. Jaldi, jaldi in the chat box please. So what is this color? Black, brown, blue. So this is obviously going to be brown color. तो पहले ऐसा patches कहाँ पे देखे थे? That was over the face. वो हो गया melasma. But if you are getting brownish hyperpigmented patches over the trunk, now in this way, so I'll just write down brownish hyperpigmented patches over the trunk. Now this has a peculiar appearance. Like this is like, just imagine कि आप लोग coffee पी रहे हो. Okay, coffee मतलब a milk coffee. So milk coffee is always brown in color. अब ये milk coffee, I'm just spilling it over your trunk, over your body. Okay, so it is like there is some part of your body which is having a appearance like a coffee with milk. So what is this coffee with milk? मिल्क कॉफी, ओके शिव, ब्लैक कॉफी मतलब ब्लैक कलर हो गया ना, इसीलिए हम बोल रहे हैं मिल्क कॉफी। मिल्क मिल्क कॉफी मतलब इट विल हैव अ ब्राउनिश कलर, ठीक है, उतना ही है। नाउ यहाँ पे, सो दिस कॉफी विथ मिल्क, in French we call it in a very stylish name, and this is called as cafe au lait macules. The name says macules, पर यहाँ पे actually क्या दिख रहा है? This is actually patches, ठीक है? So this is called as cafe au lait macules. So these cafe au lait macules, these are also can be seen in association with many diseases. जैसे, does anybody know what is which are the diseases where you can find cafe au lait macules? एक हो गया normal individuals में, ठीक है, एक या दो कैफे वाला मैक्यूल्स दिख सकता है, so that is completely normal. कभी कभी क्या होता है, when multiple cafe वाला मैक्यूल्स are present, this can be seen with many diseases. जैसे I'll give you some of the examples. This cafe वाला macules, very good. So cafe वाला macules, I'm getting the answer now. This can be seen in neurofibromatosis. Okay, neurofibromatosis में दिख सकता है, especially neurofibromatosis 1. There is one more disease which is called as a xeroderma. Okay, xeroderma pigmentosa. So all these are genodermatosis where you can find these kind of cafe au lait macules. And yeah, Kale, you're going it a little bit deeper. That is also correct, because cafe au lait macules, there are two types, one with a regular border, one with a irregular border. जो irregular border है, that we can see in McCune-Albright syndrome. I completely agree with you, Shiv. So that's a very good finding. And as Kalai is answering in the chat box, this is like cost of main, या फिर yeah, all those things are the comparison. Okay. Xeroderma is not associated with freckles. See, xeroderma pigmentosum में freckles भी दिख सकता है, okay, that you can see over the face as well. So freckles can be seen. Xeroderma pigmentosum में you can also see cafe au lait macules over the body also. Both of the things can be seen. ठीक है शिव? Done. So all these are some of the differential diagnosis. So what is the kind of message that I would like to put across here is, whenever you have a patient who is having any kind of a pigmentary disorder, आपको क्या करना चाहिए in the real time, in the real OPD, or when you are dealing with some of the exams, please try to describe the lesion. If you describe it, when the moment you try to describe, आप अपने आप describe करोगे, ये black lesion है, या फिर brown lesion है, या फिर blue lesion है. So the moment you say black, brown, blue, क्या होता है इधर? You will narrow down on the differential diagnosis. That is very, very, very important. ठीक है? So now let us also see some more examples, because not every patient will come to you very typical. कभी कभी क्या होता है कि the patient can come to you again with a color change. पर यहाँ पे the patient is not telling you कि मेरा color change is happening on my skin and my nails are also involved. Then चलो, then what do? चलो examine कर लेते हैं. So what is the change? So when you see the change in color here, you can see that there is a, what is the color here? See, can you see a change in color over the nails as well? तो यहाँ पे क्या color change दिख रहा है आपको? You can see that there is a grayish color or a bluish color, isn't it? So this grayish color or a bluish color of a discoloration, whenever you see something like this, then suddenly I shift my focus now. So when you see this kind of a discoloration, Virendra is saying pseudomonas. Excellent. अगर आपको ऐसा एक perception है कि ये green color हो गया, so if there is green nails, then this can be pseudomonas infection. जैसे green nail syndrome हो गया, या फिर chloronychia हो गया. So all these are, whenever you see green color, think about a pseudomonas infection. Whereas if you see a bluish discoloration, then what is it? Keeping aside the cyanosis and those findings, bluish color of a discoloration and all, this can happen as a drug eruption or a drug side effect. So when you use some drugs like minocycline, क्योंकि dermatology cases में क्या होता है, see, we are going to use minocycline for a longer period of time. Just say somebody had a acne vulgaris and we are treating the acne with antibiotics. आपने doxycycline use किया या फिर आपने minocycline use किया. So when there is a use of minocycline for a longer period of time, there is something called as a melanocytes. So melano मतलब pigmentation. Nychia means nails. So some pigmentation of the nails. Then you again start thinking about some bluish nails can be minocycline. All those things can be thought about. Okay? And whereas if you're in a similar ground, if you're getting a patient who is coming to you with some slatish gray pigmentation over the face, and he is also having, so he's also on some medications especially for a heart disease. So then can you tell me that which is a drug which can cause a slatish gray kind of a pigmentation, especially in a patient who is on some drug for a heart disease? Who can answer this bonus question? Mansoor Alam, very, very good evening. Yeah, Virendra is answering it right. So Virendra is able to crack it. Anybody else who would like to add to it? So this can be due to a drug which is called as amiodarone. So in amiodarone also, so Kala is also answering very good. So amiodarone can also bring these kind of pigmentation. So the takeaway message here is when we are dealing with hyperpigmentation, so what you need to always think is you need to keep a fixed set of differential diagnosis. Like it is very, very easy if you go it in such a way ki localized and generalized. Localized may again you can go localized to the face, melasma, freckles. There is also something called as lentigenes. Do anybody know what is a lentigene? Have you heard about a lentigene? I'll just add that also. Lentigenes. अभी lentigenes में usually क्या होता है कि that the patient can present to you with a black macules over the face along with the oral mucosa. So probably this you will learn along with your surgery as well. कि what happens, multiple macule मतलब small lesions हो गया, so multiple blackish or dark brown colored spots will be there over the face. Along with that there would be some involvement of the mucosa. So when you examine the lips and all, you'll be able to see कि mucosa be involved है. So what is it? Yeah, I got the answer here. Carney complex association, STK11 gene mutation. So what is it? So this one lentigenes, this is associated with a syndrome, and this syndrome is called as Peutz-Jeghers syndrome. So this is Peutz-Jeghers syndrome. It is autosomal dominant condition, and this can be associated with some symptoms. Okay, and that may most of the times what happens, the patient may end up in a surgery OPD also. So why surgery OPD? Because the patient is actually having some polyps in the intestine. And what kind of polyps can it be? Is an adenomatous polyp hai या फिर hematomatous polyp है. Now I see that many of you are knowing an answer for this topic. अब ये भी बोलो कि adenomatous polyp दिख सकता है या फिर hematomatous polyp दिख सकता है. In this case of Peutz-Jeghers syndrome, who can answer? 5 seconds for you to answer. For now I will just answer and move on. Who can answer? So is it adenomatous polyp? Yeah. Hematomatous polyp. So please remember, this is a case where a patient can have a hematomatous polyps in the intestine. Okay, hematomatous polyps in the intestine. So please keep this thing in your mind. No problem, Shiv. We'll keep learning. Okay? Nothing to worry. So that is all about different types of diseases where you can find a localized type of a hyperpigmentation over the skin. Now, after this localized, how about jumping into generalized? In which kind of diseases can you expect a generalized hyperpigmentation? Can a patient come to you saying that I feel that my entire body is turning much more darker in color? मतलब generalized hyperpigmentation हो रहा है. So what are those diseases where a patient can come with a generalized change in color? So one is going to be Addison's disease. Okay, one is going to be Addison's disease. Another example is Anyone, if you want to add on to any generalized hyperpigmentation to the chat box, you can just keep adding to it. I'll also just add few of the differential diagnosis. Another option is that it can happen in hemochromatosis. Hemochromatosis. जहाँ पे the patient will complain of a generalized hyperpigmentation. Okay, bronze diabetes, I completely agree with you. That is going to be another one. There would be a generalized this one, right? A hyperpigmentation. And can it be drug induced? हो सकता है ना, because once you take some drugs, so drug induced hyperpigmentation भी हो सकता है. Drug induced hyperpigmentation. So that is going to be other one. And sometimes what happens when there is a paraneoplastic syndrome. Okay, paraneoplastic syndrome, like whenever there is some disease that is associated with a malignancy, and when they come to us, so again there would be a generalized hyperpigmentation which is associated with paraneoplastic syndrome. So all these are going to be the differential diagnosis. How to deal with the patient if there is a rebound hyperpigmentation after long time use of hydroquinone. So what is this thing? Shiv, अभी जो आप बता रहे हो कि a patient has used hydroquinone, वो भी maybe they used in more quantity या फिर they used it for a longer period of time. तो अभी ये longer use of hydroquinone की वजह से there is a side effect, और इस side effect को what is the name? We call it as ochronosis, isn't it? Exogenous ochronosis, जहाँ पे darker hyperpigmentation हो सकता है over the skin. ठीक है? So in this exogenous ochronosis, please remember that it's very difficult to deal now because you have already used hydroquinone, and hydroquinone की वजह से hyperpigmentation हो गया. Now the only way that you can deal it with is by going for a laser therapy. Okay? Laser therapy is going to be your only way out. Chalo. After all this hyperpigmentation, now let's switch the focus into hypo. Now imagine the same situation now. आप लोग या TCA peeling, any of the fruit peelings, glycolic acid peels, ये सब कुछ कर सकते हैं. But then when you go for this kind of chemical peelings and all, you have to repeat it probably every 21 days and then have to go for multiple cycles and all. So what is preferably done is you can go for a laser therapy, and along with that you can also try this peeling and all those things, and make sure that the patient is taking a good sun protection. So UVA and UVB protection should be there. From SPF 30 we can ask the patient to use SPF 50 sun blocks. All those things can be done. ठीक है शिव? Okay. अब ये बोलो कि you are sitting in the cashier or in the OPD, और आपको कोई पेशेंट आ रहा है एंड दे आर कंप्लेनिंग कि देयर इज अ localized hypopigmentation, मतलब द स्किन हैज बिकम लाइटर देन नॉर्मल. अभी व्हेन इट बिकम्स लाइटर देन नॉर्मल, प्लीज टेल मी सम ऑफ द डिफरेंशियल डायग्नोसिस. आप लोग डिफरेंशियल डायग्नोसिस बोलने के बाद वी विल डिस्कस अबाउट सम इमेजेस. तो पहले थोड़ा डिफरेंशियल डायग्नोसिस बोलो. तो हु कैन से localized hypopigmentary disorders का डिफरेंशियल डायग्नोसिस? Pityriasis alba. So I'm just looking into the chat box. So somebody is answering pityriasis alba. Very good. Yeah, pityriasis versicolor. That is again a fungal infection. Very good. Curiosity. Nice name. Huh? The curiosity is answering. This can be vitiligo. She is also answering vitiligo. Vitiligo bhi ho gaya. Leprosy, very very good. So leprosy is also a very good differential diagnosis. Albinism, मैं अभी क्या है ना, आई एम आस्किंग यू localized. तो albinism में ज़्यादा क्या हो रहा है, generalized हो सकता है, correct? So we'll keep albinism aside. We'll keep it for generalized. Next one is nevus anemicus. Excellent. Nevus anemicus. So glad to see these answers. Halo nevus. Halo nevus. Good thinking. Halo nevus में there is a nevus which is surrounded by a hypopigmented zone. हो सकता है ये hypopigmented zone के वजह से, you can add it as one of a differential diagnosis. I agree. And always try to answer this one, because this is always there for hyper या hypo, that is post inflammatory. ठीक है, post inflammatory hypopigmentation. So after an inflammation of the skin, the patient can have either a hyper or a hypopigmentation. So excellent. I got almost all the common differential diagnosis. Excellent clinicians in the making. Huh? So nice. So now let's see some of the examples now with images. Abhi aapko na one after the other, I'll show you the images. Just see the images and tell me. Excellent, Shiv. Idiopathic guttate hypomelanosis. Nice, nice, nice. So I'll show you the images in some time. So that is also a very, very good differential diagnosis. अब ये बोलो कि यहाँ पे concentrate करो, ये जो image में बता रहा हूँ in the screen. So can you see this image and tell me कि what is this? So what I can see is there is a localized area of a hypopigmented या फिर depigmented skin. And I can see a very peculiar finding here. If I draw a line over the midline of the body, the lesion is not crossing the midline. The lesion is within the midline. It is not crossing the midline. So what is this? So yeah, Hariharan, Kalai, Shiv, all of you are answering. So ये हो गया हमारा vitiligo. So this is going to be vitiligo. To be very specific, this image is a segmental vitiligo. Excellent. Okay. So why did I say that the lesions are not crossing the midline here? यहाँ पे midline cross क्यों नहीं कर रहा है? Is it because they follow the lines of Blaschko? क्योंकि Blaschko में भी the lesions do not cross the midline. So is it because they follow the lines of Blaschko? या मैं गलत बोल रहा हूँ? So if I'm telling it wrong, correct me now. What is happening here? So this one, what is happening here is that in case it is going to be segmental, means that is along dermatomal distribution. So that is going to be along a dermatomal distribution. Clear? So don't forget about it. Now let's move to the next image. अभी आप लोगों ने बहुत सारे differential diagnosis already बोल दिया. अभी ये image में what you find is, imagine करो कि ये child has come to you in your OPD. अभी parent ऐसा बोल रहा है कि since the last 2 months or 3 months. Okay. What you can see here is, हाँ Shiv, no problem. तो अभी the complaint क्या है? The parent is very worried कि ये क्या हो गया? All of a sudden there is some white patches over the face. So multiple hypopigmented patches over the face in a child. That is the most common presentation of this one. Okay. So I'll just write about this thing. Multiple hypopigmented patches over the face in a child. So when there is a child who is having a multiple hypopigmented patches, so Hariharan is ready with the answer now. So Hariharan has said कि यह diagnosis हो गया pityriasis alba. So this is going to be pityriasis alba. Now any one of you, can you tell me one more differential diagnosis here? तो यहाँ पे differential diagnosis क्या हो सकता है for this pityriasis alba? हाँ, अभी आ गया Shiv, Kalai, all of you are answering it. The differential diagnosis here is indeterminate leprosy. तो यहाँ पे the differential diagnosis is going to be indeterminate leprosy. So what is happening in an indeterminate leprosy? क्योंकि leprosy में क्या हो सकता है? When we try to see that the patient is having his sensations intact, there would be a sensory deficit, right? The patient may not be able to differentiate between hot and cold, or the patient may not be able to understand कि someone is touching over the skin or not. So that is a sensory deficit. वो usually कहाँ पे होता है sensory deficit? That happens in leprosy. Whereas pityriasis alba में क्या होता है? Usually you can see scaling, because the meaning of this word pityriasis itself is scaling. So वैसे we can differentiate between pityriasis alba and indeterminate leprosy. चलो. So now let's see some more examples of hypopigmentary disorders. Now what do you see here? Imagine that a patient is having, let me give you some example here. The patient is having mental retardation, mental retardation. Along with that, there is a history of epilepsy, okay, epilepsy or seizures. So you're getting a child who is taking phenytoin for epilepsy, and the child's IQ is low, matlab the child is mentally retarded. Along with that, you can see that there is some hypopigmented lesions like this over the trunk. What is it? Yeah, answer is there. A very smart people attending. Okay, all the answers in the chat box, right? What is this? So यहाँ पे this one, the diagnosis can be tuberous sclerosis. So this can be tuberous sclerosis. Now, what is this hypopigmented lesion that you can find in a patient of tuberous sclerosis? So the lesion which I have marked here. So what is it? It is having a, yeah, this one is called as ash leaf macule. So this is called ash leaf macule. So it is having a tapering end. So this is called as a ash leaf macule. Yeah, lanceolate shape, hypomelanotic ash leaf macule. All these things are correct. So this ash leaf macule can also be seen in tuberous sclerosis, another autosomal dominant disease. Okay, autosomal dominant disease. Now let us see the next patient. Now you have got a patient who is again a child. Now in this child, what is happening is, you can see that there is a localized area of hypopigmentation. Localized area of hypopigmentation. अभी मैं क्या करने वाला हूँ? So you can see that there is some erythema underneath as well. So now I'm giving you an example. You just need to tell me कि यहाँ पे diagnosis क्या हो रहा है. I'm just going to take a glass slide. अभी मैं एक glass slide लेके I'm going to press over the skin of this patient. When I press over the skin of this patient, I can see that this whitish discoloration is disappearing. Okay. And once I take off the glass slide, what is happening? The whitish discoloration is reappearing. So now tell me the diagnosis. So here you are getting a patient who is a child who is having a hypopigmented lesion over the body, and the parents are saying this lesion is present since birth. So the parents are telling you that these lesions are present since birth. Now, can anybody answer what is this? Because here I did an investigation which is called as diascopy. So what do you mean by diascopy? You mean that you press the skin with a glass slide. Okay, glass slide. So when you're pressing the skin with a glass slide, what is happening? So this hypopigmentation is disappearing, which means that the lesions are blanching on diascopy. So if the lesions are blanching on diascopy, so here the final diagnosis becomes nevus anemicus. Okay, nevus anemicus. Now for you as a good clinician, when the parents are saying this magical history, I'm seeing these lesions in my baby since birth. Since birth, if it is present, if it is a localized hypopigmentation, then think about nevus anemicus, or there is also one more differential diagnosis here. So another differential diagnosis is nevus depigmentosis. See, depigmentosis matlab kya hai? The lesions are present since birth. पर it is a pigmentary defect. अगर pigmentary defect है, so if you take a glass slide and press over the lesion, there is no blanching that you can elicit. Okay? There is no blanching. So if the lesions, if they do not blanch, if the lesions they do not blanch, आपका diagnosis हो गया nevus depigmentosis. And if the lesions they do blanch, then your diagnosis is going to be nevus anemicus. And what is the peculiarity of both these things? So both these are present since birth. They both are present since birth. So yeah, so that is it about hypopigmentary disorders. Now, how about jumping into generalized hypopigmentation? So can anybody tell me some generalized hypopigmentation? अभी आपको ऐसा imagine करना है कि एक patient आ गया and the entire body has turned hypopigmented. So what are the differential diagnoses for generalized hypopigmentation? Differential diagnosis बताओ. I think earlier some of you were answering about this one, generalized hypopigmentation and localized, mistakenly. So can we have that name of that disease once again? आपको एक clue देना है तो autosomal recessive disease है जहाँ पे melanogenesis नहीं हो रहा है. Okay? Yeah. So that is going to be albinism. So what is the defect here? Melanogenesis क्यों नहीं हो रहा है? Why is a melanin pigment not being produced in albinism? Because there is a defect of something. अभी कौन सा defect है? कौन सा enzyme defect है? Albinism में. I think this is something that you all of you guys can answer. Tyrosinase, isn't it? So there is going to be a tyrosinase enzyme defect. So once there is a defect, what is happening is that, yeah. So when there is a tyrosinase defect, there is no melanogenesis that is happening. So now let's continue to the differential diagnosis. All of you are answering it right. Excellent. So now let's see what another differential diagnosis. In the chat box, somebody says universal vitiligo. I agree. Universal vitiligo. Because when more than 90% of our body surface turns depigmented, that is going to be again generalized universal type of vitiligo ho gaya. So anything else where you can find generalized hypopigmentation? See, sometimes what happens is hypopituitarism can lead to generalized hypopigmentation. And earlier I have also seen that somebody had written about idiopathic guttate hypomelanosis, isn't it? So idiopathic guttate hypomelanosis. So that is also another possibility where you can have this kind of yeah, and a very good differential diagnosis can be leprosy, because as the number of lesions would increase, there is a generalized hypopigmentation. So all these things would happen in leprosy as well. So now let's see some more things. So now let us just label the images and move on. So when we label the images, what do you see? The first one, जहाँ पे you can see that there is depigmentation of the skin, hair, and the eyes. So there is no pigmentation that you can see over the skin. The entire skin is depigmented. The hair is depigmented. That is why it is a child, but that is a whitish hair. And there is no pigmentation over the eyes also. So यहाँ पे diagnosis हो गया albinism. So this is going to be an autosomal recessive disorder. So earlier, as I told you, if a patient is coming to you with some kind of a hypopigmentation, multiple hypopigmentation, along with hypopigmentation, along with sensory deficit. So when the patient is going to come to you with multiple hypopigmentation along with sensory deficit, then here in these circumstances, then whenever you see sensory deficit, always think about leprosy, isn't it? Always you have to think about leprosy. And then what is this one? So what is this? So यहाँ पे, if I just zoom this image, can you see that always whenever you see a patient in dermatology, try to describe, ठीक है? So यहाँ पे what you see is, I definitely would describe this as multiple, क्योंकि I can see multiple lesions. So I would describe this as multiple hypopigmented macule है या patches है, small lesions है, isn't it? So these are going to be macules. So when you see multiple hypopigmented macules over the trunk, and if there is no sensory deficit, if there is no scaling that is present, in all those cases, this can be idiopathic. What is it? Idiopathic? Anyone? Guttate hypomelanosis. Idiopathic guttate hypomelanosis. So that is going to be the differential diagnosis of this image as well. Now, are you able to understand? So what you will always do is, when you start seeing the patients, always you will keep in mind कि whenever it is pigmentary, आपको ऐसा differentiate करना है कि ये hyperpigmented है या hypopigmented है. अगर hyper है तो क्या, what are the differential diagnosis? अगर hypopigmented है, then what are the differential diagnosis? चलो देखते हैं कि once you do the first round of history taking, examining the patient, अभी आपको पता हो गया कि हाँ ये ऐसे ऐसे diseases हो सकता है, then what are the investigations that we can do? So when it comes to investigations, of course initially we'll do the clinical examination, जहाँ पे हम देख लेंगे कि distribution कैसे हैं, ये क्या ये localized है या फिर diffuse है, isn't it? All those things, whether it is crossing the entire the midline of the body, how is the pattern of the rash, ये सब हमें देखना पड़ेगा. और उसके बाद when we do some investigation, you can do a wood slam examination. अभी wood slam में, thank you so much शिव. तो now अभी यहाँ पे क्या हो रहा है कि wood slam examination, जैसे समझो कि एक patient है who is having vitiligo. अगर vitiligo patient है, so if I do a wood slam examination, what is the color of fluorescence that you can expect? Vitiligo, what is the color of fluorescence that you can expect? Can anybody answer? मैं आपको सारा options देता हूँ. Green color fluorescence, red color fluorescence, blue color fluorescence, whitish fluorescence. Anyone? Yeah. So here you can find ivory white fluorescence. So earlier some of you said कि आपके differential diagnosis में, अगर if somebody is having a hypopigmentation over the back, तो ये एक fungal infection भी हो सकता है. What is that? Pityriasis versicolor. तो अगर pityriasis versicolor है, pityriasis versicolor है, so in this case, what is the color of fluorescence the body will show when you do a wood slam examination? So anyone, if you are able to answer about vitiligo, I guess you should be able to answer about pityriasis versicolor, yeah, tinea versicolor also. So what is your wood slam examination finding? Again, the same option. Blue color देख सकते हैं, green color देख सकते हैं. What are you going to see? So this can be compared to, very good, this can be a pale yellow or apple green fluorescence, isn't it? So it can be a yellow color or an apple green fluorescence when it comes to pityriasis versicolor. And obviously, like in most of the diseases, we can also go for a dermoscopy, because when it comes to diseases like vitiligo, when it comes to diseases like melasma and all, there are pigmentary patterns. There are pigmentary patterns in diseases like melasma, vitiligo, etc. Clear? So that is how you are going to do it. So is there any role for blood investigations? जितने भी diseases है pigmentary disorders में, तो कोई भी pigmentary disorders में, should we do any blood investigation? Is there any role? What do you think? When a patient may come to you with pale colored skin, that can be because of anemia, isn't it? The hemoglobin can be low, so complete blood count we can do. Anything else? जैसे Addison's disease हो गया, you'll have to go for a serum cortisol, isn't it? So let us say that serum cortisol we can do, isn't it? So serum cortisol can be done, ACTH can be done. So all these things can be measured because of Addison's disease. Addison's disease, because there can be a generalized hyperpigmentation. And then in some patients, let us say that a patient is having vitiligo. So in all those things, there is a close relation with thyroid or endocrine diseases and all. So we can go for thyroid function test, especially in cases of vitiligo and all, isn't it? So all those things can be done. We also will have to go for all those iron studies like serum ferritin or sometimes vitamin B12. All those iron studies, all these things can also be done. And finally, when you want to do a confirmation of diagnosis, then you can go for a skin biopsy as well. So Virender, नहीं, diascopy or dermoscopy different है. Dermoscopy, if possible, in the next lecture and all, I'll show you the image of a dermoscopy, because it looks like a small hand lens, but it can give you some various patterns. Okay, once you start observing different diseases, so every disease will give you different types of pattern. That is called as a dermoscopy. What different है? Diascopy means, remember our glass slide. So glass slide is equal to diascopy. Whenever we take a glass slide, press over the skin, हो गया diascopy, and dermoscopy is an entirely different procedure. ठीक है? And general management, abhi management will be different. Of course, we discussed about so many diseases today. So for each and every disease, there is a different kind of management. So we'll have to go for some lifestyle modification. We'll give specific drugs. Like today, somebody asked me, what is the management of overuse of hydroquinone, right? So hydroquinone is skin lightening agent. So hydroquinone, we use it whenever there is going to be any hyperpigmentary disorders. Hyperpigmentation, we can go for skin lightening agents. If there is some autoimmunity and all, you can go for JAK inhibitors. We can go for steroid treatments. And all those diseases like vitiligo and all, we also go for phototherapy. So it is not possible for us to generalize a treatment. So treatment again depends upon what is the kind of disease, what is the final diagnosis. In case हिसाब से we'll reach out to the treatment part. Okay, so in the summary, so the pigmentary disorders, there is a vast presentation, lot of differential diagnosis, and we'll have to narrow down the differential diagnosis if you go on a very symptomatic approach. Hyper or hypopigmentation, that will be the easiest way, and then you have to decide on the diagnosis and the management part. Okay, Shiv, the next lecture I guess is on 10th, and we'll be talking about a very common disease like acne and its common features and how you should approach acne vulgaris. So that would be the next lecture. In the meanwhile, definitely go through the clinical corner in the Meded app, where you can find lot of cases. And when we have a next session, please let me know if you have any queries and all. I'm always happy to help. So thank you all of you. Thank you Kalai, Virender, Shiv, all of you who were very active today in the chat box. That made the session very interactive and nice. Okay, thank you so much. We'll again see you for the next session and more clinical approach to dermatology coming up shortly. Okay. So I'll see you again. Thank you so much.